My name is Dr. Haley Thompson, and I have a few roles at Wayne State University, but tonight I'm here as Director of Checkup, the Center for Health Equity and Community Knowledge in Urban Populations, Checkup, right? And so what you hear at the center of that, health equity is community knowledge, because I and the others who work with Checkup firmly believe that all different types of expertise is needed if we're going to deal with the health problems in our communities, right? So people with the PhDs and the MDs and so on have one set of expertise, sometimes what we call content expertise, but certainly folks who live in communities, living on the front lines, dealing with chronic illnesses and conditions, have context expertise, right? And both are needed. We're never going to make any difference when it comes to these issues if we don't bring both together, right? And we just value everywhere the knowledge comes from. So that is what Checkup is dedicated to, really facilitating community academic partnerships and advancing like the science of community outreach and engagement. So that's part of the reason why we do workshops like these, right? It's because we want to give people knowledge, information, and tools to create these partnerships in ways that are equitable, transparent, meaningful, and effective. So I'm really excited about our program tonight here, Ethics and Challenges in Community Academic Partnerships. I'm really, we're very grateful to all our panelists. We'll get to, you'll hear an introduction of those folks very soon. Before we get started though, I just wanted to sort of acknowledge that, there's a lot of conflict going on in our world today, right? Locally, globally, and a lot of people are feeling a lot of different things about it, having a lot of reactions, feeling very stressed in so many cases. Some people are feeling depression, anxiety. So we just want to acknowledge that. If you need to take a break from tonight or, take a break, give yourself breaks. We certainly give you that grace and space because there's a lot going on and we want everybody to stay as mentally, physically healthy as possible. But I just want to just acknowledge some of the things going on outside of these four walls or around these virtual walls. Okay. So with that, I'm going to turn it over to our moderator, our Associate Director for Community Inclusion, Dr. Carrie Leach.
Thank you, Haley. Are you supposed to, is she supposed to keep this mic for questions, Naya, is that right?
They can hear you now.
Okay, great. Thank you, Haley. So, hello to everybody. Online sound is good. They can hear me. Hello, great. So, who's this lady talking? I am Carrie Leach, as Haley mentioned, and I'm an assistant professor at the Institute of Gerontology at Wayne State University. So I love thinking about what happens to you in life after you turn 65, 75, 85, and 95. Everything that happens before 75, I think, it's boring. It all gets fun and exciting around age 75 for me. So that's what gets me out of bed and gets me excited. And also doing community engaged research. It's my passion. It's why I went to school and finished a PhD, because I really wanted to help people leverage research to the benefit of their community. And so that's really my passion in research. And so for the last few months, we've had a lot of different sessions about community engaged research. Some of the challenges that come up for people in different roles. So take, for example, getting promoted and going through the tenure process, like Dr. Maha, who's here on our panel, submitted her package last night. And so she's going through that challenge. But what we're here to talk about today in terms of challenges of community engaged research are the ethical considerations and the challenges that are embedded and that are important and should be thought about, carefully considered when you partner with people and communities. As a researcher, I have tools and skills that I can offer communities. We don't intend to solve problems in communities, just offer our skill set to help people solve their own problems, right? And so that's what I do. That's what we're here to talk about. I'll give you a little story about my own challenges and ethical considerations in research. My very first interview I ever did, the goal was to involve older adults in a community and reach the most vulnerable and hard to reach. In my very first interview, I thought I'm at this really nice house in this rural area, and it was a Caucasian man who seemingly had everything looked great. And I sat there with that man for about 90 minutes, and about 90 minutes in is where he really started to open up and talk about the fact that he was illiterate. And I, right in that moment, thought, you read a consent form before being in the study. Uh-oh, you don't know what the study is about. I didn't consider that somebody can't read. And I'm sitting here with this gentleman and he talked about his wife passing away and that she read and interpreted bills and all kinds of things for him. And it was about 95 minutes, 100 minutes in, I realized the chairs that we had been sitting from this beautiful window that he loved to, he just sat in front of that window, was covered in bed bugs. And I was swarmed with them. And I thought, we have a lot of, and then he started to tell me about challenges with his banking and fraud, but he can't really interpret what the letters are saying. So I had to really think about what's happening in this moment, in this scenario, as somebody that, it was my very first interview I ever conducted too, right? Lesson on lesson on lesson on lesson. And so that's just my very first introduction into research. And so obviously I worked with my community partners and we had to decide and go back to our institutional review board and think about how to address or intervene or what we do in that community with that particular person. Most recently, one of my challenges is co-writing a grant with a partner I've worked with for 9 years. 2 years ago, we wrote this and it's funded right now. We learned that she's not able to participate in that grant because the funding that I would compensate her for, that she helped me write and had considered the budget process, but was putting her housing in a vulnerable situation, right? So her low income housing, if she received that much income, it would put her over a threshold. So that was a new experience for me. And I've been doing this for 9, 10, 12 years, maybe quite longer than I thought. And so those things continue to come up for me in my own research. And so we have this panel of experts it's very exciting. We're going to hear from them and take some lessons from their expertise. And so I'm going to read bios so you can learn a little bit about these amazing panel members. We have 2 here in person and you'll see online, Dr. Jamie Mitchell. She's at the University of Michigan and you'll be seeing her face because we will post it online. And I would also just mention, say thank you to Dr. Radlisha Sneed. You can see her in the upper hand corner. I work with her at the Institute of Gerontology. Radlisha, do you want to introduce yourself so we can learn more about you? She's moderating our online community. Can you hear us? You're muted.
Hi, everyone. I'm Dr. Radlisha Sneed, as Carrie mentioned. I work with her at the Institute of Gerontology. I'm happy to be here. I'm also a faculty collaborator with Checkup. Like Carrie, I love community engaged research. I do a lot of community engaged research working in partnership with older adults and agencies that serve older adults. And I'm here moderating online so that the people who are not able to be in person are also able to participate and interact with our panelists as well. So I'm very happy to be here and welcome to everyone.
Thank you, Radlisha. So thanks to Alex and Naya and everybody behind the scenes that you don't notice, you're not seeing, for putting this all together. Just want to always acknowledge our colleagues because we can't do this without them, that's for sure. So I will start in alphabetical order with Dr. Maha Aljort. I'm a huge fan of hers. So Maha is a board certified advanced public health nurse who earned her PhD in nursing at Wayne State in 2017. And her research interest is the health of minority and immigrant adolescents and young adults. She conducted several projects among the Arab American community. I've learned a lot about the community from her and continue to learn, exploring psychosocial stressors such as childhood adversities, discrimination, acculturative stress, social support, and parent-child relationship influence on physical and mental health of adolescents and young adults. And so just so you know, for the online community, we do have a program where you can read more about all of our panel members, but I'll just stop there and say welcome and thank you for being here, Dr.
Thank you.
And then we have in person here, Kenyatta Cole, which we're very excited to have. Thank you for making the trip. Ms. Cole is a president of iCole Solutions, a provider of specialized technology solutions, particularly for the healthcare and nonprofit sectors. She's technically minded, data-driven, and innovative professional with over 15 years in technical systems operation management and project implementation, as well as change management within the healthcare industry. excuse me. Ms. Cole holds expertise in implementing electronic health records, managing data security, systems integration, leading teams to achieve organizational goals, and maintaining compliance with regulatory standards. She's also adept at introducing and leveraging technology to help increase the use of healthcare. That makes me so excited to hear. Somebody needs to be doing this important work. Information technology to improve, direct, execute, and monitor quality metrics to provide value-driven care. Her experience includes technology, business development, and management consulting roles with organizations such as Kaiser Permanente, Ascension Healthcare, Spectrum Health, and Detroit Medical Center. And she has contributed development and execution of complex hepatitis C pathway to enhancing screening, diagnosis, and triage to treatment for providing timely care, which led to organizations receiving the 2018 James A. Bose, am I saying that right? Yep, okay, good. Regional Quality Award for HCV pathway. She's also designed and implemented functionally providing ability to capture point of care medical images from non-diagnostic image modalities that allow for the integration of those images with existing digital imaging infrastructure. Ms. Cole has a passion to develop solutions that will end the digital divide. Oh my gosh, as my dad said, can I get an amen? Thus ensuring that underserved communities will no longer be negatively impacted by the lack of access to technology. Oh my gosh, a reliable internet coverage and gain access to quality healthcare. Always willing to give, Ms. Cole served as a community advocate. She is a lifelong member of the National Council of Negro Women Incorporated, and is a member of NCNW National Membership Committee. She currently serves as the president of the National Council of Negro Women, Detroit section. In this role, she increased the presence and awareness of NCNW's mission by forging partnerships with organizations such as Carmano's Cancer Institute, where Haley is a leader there, the University of Michigan Rogel Cancer Center, American Cancer Society of Michigan, and St. Jude's Children's Research Hospital. She's also an active member of the following NCNW affiliates: Alpha Kappa Alpha Sorority, Inc., and Eta Pi Beta Sorority. Ms. Cole earned a master's degree in medical informatics from Northwestern University and a bachelor's degree in computer information systems from Davenport University. Thank you so much for being here. How
Thank you.
impressive.
You were not supposed to read all that.
Well, we want to know a lot about you, who's sitting at the table and is going to advise us and the amazing expertise you bring. I want to honor that as well. So.
Yeah.
Next, we have a picture of Dr. Mitchell we can put up so we can see her lovely face. I'm not sure if she's on camera. She's in the middle there. Dr. Jamie Mitchell is an associate professor of social work at the University of Michigan School of Social Work. She has published over 40 peer-reviewed publications on 3 interrelated lines of research focused on health of African Americans. 1, barriers to high-quality cancer and chronic disease care for older Black men. 2, health communication and health self-management for older Black men. And 3, research participation for Black older adults more broadly. She's part of and a co-investigator of the Michigan Center for Urban African American Aging Research. That acronym is MCAR. I always pronounce it wrong. Sorry about that, Jamie. And she helps to oversee a multi-university collaborative research infrastructure and co-manages the Community Advisory Board and participant research registry of Black older adults at the Healthier Black Elders Center, which is in Detroit. And this is a very long description, and that more information is online in the program. And I'll just stop there. Jamie, do you want to say hi in a word? And just, yeah, thank you for being here.
Hi, everyone. Thanks for having me. I look forward to the discussion.
Great. We can hear you well. Okay. So our format is this. We crafted a few questions that we wanted to ask of the panel members. And so we will pose those questions. They had a chance to review them. And then we'll take questions from you all in person. And Radlisha will step in at any time that she sees fit with questions. And I guess let's go in alphabetical order, maybe. What do you think about that, Anna?
Yeah, sounds good.
Great. So the first question for our esteemed panel is, can you talk about a specific challenge you faced in a community academic partnership and how you overcame it?
Yes. I'm not sure if I should use the mic or everyone can hear me well. Okay.
Okay.
So online.
I have one person doing this with their ear, so maybe.
Okay.
Oh, you
So
want the mic?
okay, I can use that definitely because
Thank
I want
you.
everyone to be engaged.
Thank you.
So I think that's very interesting topic to talk about, and especially doing multiple projects. I think the most important challenge that I really discuss over and over again is actually getting everybody on board and excited about what you are doing, and they see through the benefits of doing that. My work involved adolescents and young adults, and that's like a very hard age to actually engage them and also get the parents invested and want to see the value of participating in research. Also, I partner with community centers, and I have to acknowledge their priorities and, you know, get them on board. So we always have those levels. So we have the community members and we want them to be on our side, and we want to benefit the community. And also we have the community agencies and their priority and their team and get them on board. And there's always sometimes there's disconnect where, you know, you talk with the leadership of the community agency and they are on board, they understand, they want to do stuff, but then when you actually do the work, here's the disconnect. The staff don't actually know the legends of doing research, and you have to, you know, jump through hoops, especially with limited budget and no money. So that's add to the hardship. But I value, like, the most benefit strategy that I use is to do a lot of education, and I really value that. I value telling every level in the agency that I work with about, you know, research and how to be a partner in the study, not just the place to do the study. And I do a lot of education with people involved in my research, because I do my research in mosque and I do home visits. So I visit people at their homes. And then I answer all the questions they have about what I'm doing. So for example, the last study, I looked at metabolic syndrome and depression in relation to psychosocial stress, like discrimination, adverse childhood experiences, and also, the metabolic syndrome, thank you for asking. And that's actually a disorder where the body is not doing the metabolism correctly. That results in high blood sugar, high fat levels, gaining weight, and people in that state are very prone to have chronic diseases. So they are prone to get diabetes, they are prone to get heart problems. When these things happen at a young age, like adolescents and young adults, they are more harmful, because then they, you know, they start on that risk very early in their age. So when I do interviews with the adolescents and their parents who agreed to participate in this study, I spend more time than what I say I will spend. Like if I need 15 minutes to finish everything or 30 minutes, I spend 2 hours, because I take the time to answer all the questions they have. And they ask me, why are you doing this? And why it's important, how we're gonna benefit from that. And I take that moment, and I think it's a very important role for us who do research with the community to tell them about what I am doing and how they get a benefit from that and what's the value of doing that. So I guess, you know, having community members on board, on your side, interested in what you're doing, but also do that through patience and enough education and informed decision. That was a strategy I found very beneficial.
So, thank you, Maha. So Maha said is everything is typically things that we do see. So from a community-based perspective, you know, I would say that the biggest challenge that we always seem to face, in no matter whether it's a healthcare system or academia reaching out to us to get some participation, it's about the mismatched expectations. You know, what are you really expecting for us? You know, I'm always about the 5 whys. Why are you asking us? What are you expecting from us? Where is this going to take place? You know, and it's about making sure that, you know, before anything is introduced in our network, I would say, that they understand and that they're going to have a good understanding. Like I had a brief conversation yesterday about the fact that, There's an upcoming research study that they want us to actually promote. And my age group for my network that I have in our organization now is 14 to 98. So who do you want to talk to? You know, again, what is the expectation? Who do you really want to participate? So my thing for that is that researchers have to make sure those questions are targeted for the audience you are talking to, the audience that you really want to engage. So if you want to talk to my 14 and 18-year-olds, then the questions need to apply to them. And kind of, I want to see them, you know, I want to see them and make sure you are asking them in the correct way. You're not going to insult them. You're not going to have their parents calling me saying, who is this and what is this? You know, those kind of things. And then for my 19 to 24 years old as my collegiate, again, it's the same thing. I know they think they know everything, but again, you know, I want to make sure that you're asking them and that it's beneficial to them, you know, because some of the stuff that you're asking for them to participate in is going to take away from their studies. So I want to make sure it's truly beneficial, it's going to have a positive impact, and it's something that they usually basically can add to their agenda or their resumes or just a lifelong learning experience, and it has an outcome. And then for my 25 and 98-year-olds, it's the same thing. Some of them are still working. What is the benefit for them? What is it? What are they going to learn? You know, again, and what are you truly expecting from them? So that clearly has to be defined. So we've had these conversations with different organizations that would love for us to participate and do different things, but you can't tell me why. You can't tell me really what your study is focused on or what is your projected outcome you're trying to reach. And that is something that our organization, our members really want to know because you are taking time. The other thing that I find is know your audience. So when you come talk to us and you have these expectations, you need to make sure you understand what our culture, our diversity, and our makeup is. So, you know, some people come with socioeconomic preconceived notions. You cannot have socioeconomic preconceived notions in Detroit, Michigan. You just can't. We have every diversity, we have every range of socioeconomics in play. That exists in our organization. We have college educated, we have teachers, we have retirees, we have some that were just never college educated, but they are educated. So you need to make sure you understand that, and those questions need to be able to apply to all of those. So again, it's about the misconceptions. You know, one of the things I really just say is make sure you understand your audience. So, you know, when you're doing that needs assessment or you want to talk to that community, analyze your community, you know, ask those personal general questions that are going to allow you to develop your research questions and your research study. So you're not offending them and you're getting the answers and making sure it's beneficial to you as a researcher. So I'll stop there.
I could just clap. James, yes, Dr. Mitch.
I agree with the points of both speakers. And I would say in my area, one of my challenges has early on in the project that I've been working in the last 3 years, which is working with older adults who want to engage more in research in the Flint, Michigan area, is that I didn't have local cachet. I didn't have local capital. You know, I didn't have kind of like a local network to connect to. I was really kind of an unknown entity from, you know, kind of a name brand that not everybody in the community trusted for good reason, for some of their past experiences that had nothing to do with me. And so I had to figure out, you know, how do you navigate a new community that you're not necessarily a part of, but that you want to support. In this case, I actually had funding to do this project, and I wanted to reach out to folks who were trusted stakeholders in the community and really get their feedback about, you know, I don't want to just, you know, hop into town and say I'm here and I've got this funding and I want to do good work here, but I really wanted to make sure that I had a proper introduction to the community, that I was able to build relationships, and that actually takes time. You know, those of us who work with community members know that this kind of work takes time. Unfortunately, some of the time that takes, sometimes a year or more, isn't always aligned with like funding priorities, or if you have a funding project that expects you to hit the ground running, you know, you don't necessarily have time, you know, to build those relationships the way that you would like to. And so in my case, I really had that challenge of not having any, you know, recognition in the community, coming up against a lot of existing mistrust. And I concur with the speakers who said, you know, they're doing a lot of educating, they're doing a lot of, you know, showing up. But in my case, also navigating unspoken norms. You know, so for example, I was working with a community that had particular norms around churching. We had a population that has a high church engagement, and so we wanted to make sure that any events that we did were kind of conforming and respectful of what they would expect. And so in my case, I was able to work to identify local stakeholders, community members who have been on boards and who serve in their local community in all these various capacities, who believed in the mission of the work that we were trying to do, and were willing to make those introductions for us to kind of smooth the way in terms of allowing us to build trust in a shorter amount of time, to lend some of their amazing reputation to us as we were getting the project off the ground. And then we also took the time to go before all of the existing organizations in our space. So there was already a community ethics review board. There was already some community advisory boards that were operating on other projects. And we really wanted to take the time to introduce ourselves to them, to ask them for their feedback, and to kind of get their stamp of approval. And that really was helped smooth our entrance into this particular community space, and allowed us to build some early trust and engagement. So, yeah.
Dr. Mitchell, that's such an important topic and is a great segue into our next question related to building trust. I appreciate you gave us so many different, all three of you. The themes that I'm hearing for are like taking the time, having dialogue, communication, so you can, and repetitiveness, right? And educating people and saying things over and over and over again. I read a statistic somewhere, like it takes us 7 times to hear something before we go, oh, I got that. I know now that where the event's going to be and whatnot. So taking the time and having, the dialogue with people is so important, so that you can make sure that you establish those mutually beneficial goals that work for the community you're serving. And I wonder if each of you can just give us an example of trust central to community engaged research and very fragile. And I wonder if you can just talk about the role of trust in each of your relationships and strategies that you rely on to establish it, right? Especially when you're not from the community, like Dr. Mitchell was referring to, establishing it, but also maintaining it over long periods of time, which is also its own kind of unique challenge to doing research. Maha, you want to start?
Yeah, sure.
Is it on?
It's on. Yeah.
No.
Thank you. Oh,
This is the principal.
thank you so much.
Thank you so much.
No problem.
Thank you. I'll just hold that all the time. Maybe that's more safe. Again, that's a very important question, and I think the most important strategy is to build that trust, is to exactly show the community that we're partnering in the work. We're not here to do our work and then get away and finish that project and never show up again. I think that's the worst thing you can do. The best approach is actually to have that partnership and get them invested in what you're doing, and hopefully that will lead to future collaboration or lead to the next step or to the next project. Also being honest. So I just talked about the financial challenge. And when you are partnering with community agencies or community members, or you have people that invested in your work, you have to be clear about the expectations and the financial gain, or what resources they will give to you and how you're gonna reimburse whatever service they provide. So these small things are important, and being clear upfront is very helpful to have that clear communication and expectation in the beginning. But again, having that partnership and sustain the relationship is like the most important thing that I can see, and never to look at doing projects as those silos of doing one thing, and I'm not going to report back again to that agency or that or the group of people who are working with me. So and it's hard to do, especially sustaining the relationship throughout the years, but it's worthwhile. All the efforts goes in and rewarding on the long run.
So, we did. Can you hear me? All right. Can you all hear me? I definitely agree with what Maha says. And then I would also say from, the African American community, you also have to think about the fact that, again, everybody still thinks about the Tuskegee experiment. That is never going to leave the mind of the Black community. Henrietta Lacks, that is never going to leave the mind of the community because people know about it now. It's a new, especially now that the John Hopkins has set up the school. A lot of people didn't even know who Henrietta Lacks was, but now people do because of the lawsuit that John Hopkins just settled. So now it's in the paper, you know, as things go on. So you have to build that trust. So that means you need to be transparent. The other part of that transparency piece is you got to go where we are or where the people are. So the perfect example I say is that we were trying to figure out how to get African-American men and women to just get an annual exam or get their blood work. You know your numbers. You hear that all the time. So you know what we did as an organization that I previously worked for? They were like, yeah, then what are we gonna do? And I'm like, I'm IT. What are you asking me? And so it was really, I was like, well, you gotta go where they are. You know, if you wanna have a health fair, they're not coming to the health fair, so you gotta take the health fair to do. We did mobile vans. We went to the barbershops and the beauty salons on Saturdays. We parked outside and said, okay, we're giving free haircuts. Who wants their blood tested or who wants their number, know your number. So as they were waiting to get their haircut, we were running the test for that. And the same in the beauty salons, as they were waiting, like if they were sitting under the dryer or before they got under the dryer, same thing. It was about going where they are to trust to say that, we are not here to hurt you or cause you any harm. We just want you to make sure you know your numbers. And again, it's all about that for the community is being transparent and making sure everybody understands. One of the biggest things I say is that to make sure you're being transparent and make sure you have that trust, ask them to repeat back what you just said to them. Make sure they fully understand because some people hear things differently. I know every day. I spent 8 hours on the call today, and I can tell you at least 5 of those calls, somebody came off the call and said, I was like, that is not what we just talked about. But so it's important to make sure because if you want to build that trust and they don't understand and you assume, then that's a problem because they're going to go through the whole research experiment. They're going to go through the whole project thinking of one thing where you have enough, and then your level of trust or your trust and understanding is going to be different. And that's going to be detrimental to your data and that aspect of it. So it's just very good to make sure that everybody understands, and kind of go where they are. And again, my biggest thing for that is, just be transparent. I know some of the researchers come in and say we're having incentives. Some people don't necessarily need the incentive to participate. They are literally interested in making a better community, making a better improvement in their life, or how they can help and be helpful. So it's not always necessarily about the money and the incentive. It's just about what is the outcome? What is the benefit? Is this going to help my community? Is this going to help me? Is this going to have a family member? For example, anything that related to cancer, we all know that any of the cancer research studies that we can particularly participate in now, we have had someone in our family that's been impacted about it. So that's an incentive right there, not necessarily financial or monetary, but you need to trust in the fact that you're explaining that to them and explaining what your benefits and your outcome is. And, and I'm not going to keep saying it. It's all about transparency. Everything has to be transparent. And make sure they understand it and make sure they can repeat it back to you because otherwise, it's just going to have a negative impact.
Thank you so much for this. Dr. Mitchell?
Yeah, Dr. Cole really hit the nail there, in terms of transparency. She got my comment. I was going to say something similar, which is, people know when you're not being genuine, and so folks can read that, right and pick up on that right away. And so, being authentic, being transparent about what your motives are, what you're there to do, is really important for folks to kind of feel like they can trust you. And then also, if we say that we're going to incorporate feedback, then we actually have to do it. So, we have free community events through our Healthier Black Elders Flint program. There's also in Detroit as well. And so if our advisory board, which is made up of community members, says this is the speaker that folks want to hear from, or the seniors in this community are really concerned about memory care, then you need to deliver on that. Not just say I hear you and then deliver something else that that's not of interest or wasn't a part of their feedback. So definitely respecting folks' voices when you ask for their feedback. Actually take it. And then I found that if you have the resources as a researcher to compensate people for their time, to show them that you value them, even if it's just something small, that means that goes a long way, because folks don't have to engage with your programming. They don't have to come to your events. They don't have to join your registries or your studies. And so, I do find that folks may not be like super motivated by it, but they very much appreciate, when you show that you value their time. That's a part of building trust as well. And then I also found that just going out of your way, if there's a particular issue that's raised in the community group or the organization you're partnering with, even something small, like we are doing a study with Healthier Black Elders where folks get a $20 gift card. It's not much. It's just what we have budgeted for. However, we found that, after a while, those gift cards expire, and we didn't realize that. We thought they were good until folks use them. And it was in the very, very fine print. And we weren't handing out the gift cards. They're coming from the university, research office. So we're nowhere in that process after we submit their names and, verify a few details. And so once we figured that out, we started sending out postcards to folks who received the postcards or the gift cards to say, hey, check your gift card. If the balance is zero, or if they've been taking off a service fee every month and now there's nothing left, let us know. And even though it's a ton of work to go back and ask for a new gift card to be reissued, we're going to do that because you trusted us with your data, with your information. You participated. And we promised you this small incentive, and we want to make good on that. And we don't want you to go to the grocery store or the gas station or wherever and be surprised because there's no money there. And we said there would be. So, even little gestures like that, just kind of overcoming those administrative hurdles are just things that we try to do to be consistent and build trust and make sure that folks know that we mean what we say.
That for all of the decades we've all been doing community engaged research, to not know that a gift card is going to expire is so frustrating. Those micro details that you just don't anticipate, and then you have to do all that follow-up work and burden more people that are in the community, gave you the contact for those. That's a lot of work, but I think that really demonstrates it really. People interpret that as you seem more trustworthy, you're following through, you're doing what you said you do. A great example of that. So thanks so much for sharing that. Not only is listening, I think, one of the most under-taught things, but following through when you're listening to somebody and what they ask for, including also being mobile and meeting people where they are. And I know you do a lot of that at the Healthier Black Elder Center in Flint, mobile and moving around the city and meeting people where they are. So thanks to all of you for those great examples. And so I wanted to, we know how to do the work, and we have advice for community engaged research, but I wonder if you three could reflect on who you are in the process and think about the soft skills that you bring that you think are important. If you're going to talk to somebody else and give them advice and they're going to engage in community engaged research, what do you think is important for a researcher to enter a community and show up and have as a soft skill? I want to start.
So the list is long, I know, but I think I want to share, the story with my first study as a PhD student, and that was 2015. I was doing interviews with victims of bullying, and there were actually adolescents who were experienced victimization, and it was chronic. And it was because of their background and where they are from. And I think the first meeting, the mom was so worried. I did home visits, and then the mom was so worried that she want to monitor what the kid's gonna tell me, because she was so worried that the school gonna expel the kid. And then she assumed that what I'm doing gonna be reach to immigration and affect their immigration status. So I was appalled by what I'm assuming about the people that I'm working with, it's not true. Like it's different. And I have to stop and say, okay, I have to do education about research and how I'm going to use the data. And that's has nothing to do with their immigration status. It's not going to be, nobody going to know the names of people talk to me, confidentiality. So they sign the consent form, but did they actually understand the terms in the consent form? So then I make it my mission to, whenever, before I start talking to the kids, I explain to the parents that how I'm gonna use the data, it's not gonna affect them personally. Nobody gonna come after you because you said what happened. Your immigration status has nothing to do with what you report in the study, and all that information. So in nursing, we have a nice quote from a famous theorist, said nursing has the art of unknowing. Like there's an art if you remove all your assumptions aside and you come like with no assumptions and learn when you do the process. So I think that was a great approach in the beginning, like to learn what the people you work with and you serve actually need and understand and think about what you're doing, and then start from there. And we have people in different stages. So because I have some experience with African American adolescents, I did collaborate with projects with the African American community, and they a little bit advanced, so they understand the research. But they sometimes don't trust the process or what you're doing. So it's different mistrust. But then with my immigrant community, I see it from a different side. Like, they see everyone like, from one end, like you're connected to their immigration, you're connected to their food stamp, so it was fascinating to me to learn, okay, what they assume about research and what's my role in that. So I think my advice to anyone who do research with community is to not to have assumptions and learn from the group you intend to work with and serve.
That's a great example. Thank you so much.
So I would say, soft skills, one of the things I would first say again, piggybacking on Mahan assumptions, you cannot have assumptions. So you have to have open-minded. You have to come in there and say, okay, this is my focus. This is my research. This is the goal. This is the outcome. And then come in there and be able to explain it based on your audience that you're actually presenting it to. So that, lack of assumption, open-mindedness. So that what I say would be like one of the major first kind, soft skills. The other one is empathy. So you can actually have said, and everybody can understand, they can have did their informed consent, and then something can happen. Something can happen in their life and whatever, and changes it. But if you want them to continue to be a part of your research because it doesn't directly impact them for being in the research, other than that they're having some trauma stuff, you have to have empathy to figure out, okay, well, can I put this research off or this interview off for this day, and offer them some grace in that conversation, saying, whatever the situation is, if it's a loss, just say, I understand, no worries, let me know how I can be of some assistance. Let's reschedule, if you had a day or that. But it's about empathy and grace. Those are things that I say you always need to make sure you have. The other thing is, again, know your audience. Do not come in here and talk to us about diabetes when some of our audience still call it sugar. Those are the things you have to understand and know your audience in that situation. And so don't come in there using big words or making sure or talking, just trying to show your high level intelligence. We have had some, I would say, pharmaceutical companies present themselves in that manner. And I'm like, you're not going to get past me to even talk to anybody, because I'm like, yes, I understand it, but that is not the audience I'm going to put you in front of. So it's all about making sure you understand your audience, make sure you understand the conversations, and be respectful. You have to be respectful. So open-minded, empathy, and respectful. Those are the three things that I think any top researcher needs to make sure they have, because you are not going to be on the same level sometimes with the person that you're getting ready to interview or you asking to be that. So you have to respect that, and you have to find some level, some middle ground for that level of respect. I know some people are very direct, and some people are easily offended by elevated voices or certain use of words. Those are things that you have to take into consideration. So that's also about being able to read people's body language. So you have to learn and understand and be able to look at that because it's always different. So, again, it's all about gauging your audience and just looking at those, I call them kind of interpersonal skills. The thing you want to treat people and talk to people like you want somebody to treat you and talk to you, ultimately.
Thank you so much. Jamie, you want to go next?
Absolutely. I agree with both of the speakers. They make such amazing points. And I feel like there's a common theme in there between the empathy and the respect. And I also hear a lot about communication. And so before I receive funding for the work that I'm doing right now in Flint, I was a health communication researcher, and I knew how I had a chance to learn how important it was to make sure that we were communicating in a way that was jargon free, that our audience could understand. And then I also think, even building on what Dr. Cole said, is that a huge part of communication is listening, and being able then to respond, being open-minded, as our speaker said, respond and communicate across difference. So like, we may not come from the same background, but I value your voice, and there's probably a compelling reason, why you're saying what you're saying. So for example, we were setting up some new programming in Flint, and we wanted to give out, I want to say it was like a raffle. And we thought, oh, this would be great. And we had a couple of community advisory board members speak up and say, oh, that's not going to work. Folks aren't, the older adults in this part of the community aren't going to be attracted to that kind of event. And we thought, okay, well, tell us more about that, because I'm not from the area. And it turns out that, some of the folks in that area affiliated or associated that type of raffle with like gambling, and gambling was not a part of their belief system. And so we said, oh, we never would have known if we had not inquired deeper, really, if we had tried to go do some event without bringing it to our advisory board or asking our community stakeholders, kind of what would be acceptable to the community. If we hadn't had that step, then we definitely would have run afoul, and maybe we would have even, lost trust or lost reputation with the folks that we were trying to reach out to. And so one of the things that we work on and we try to do is just to always have that to just listen and try to really understand what the cultural or societal or social or environmental reasons are. There's always a compelling reason behind the decisions our community members are making, and we just need to better understand that from the research side, and then do our best to incorporate that and to work with our community members on that. And then it also has taught me that there's one way that we communicate with our institutional review boards and our funders and things like that, and that's a different skill set than communicating sometimes with the community members that we partner with. And so, as both of the speakers have said, we need to set that, brain sometimes aside and really be open-minded about, what our partners are trying to say, and not bring that jargon to them, as Dr. Cole, said, because you're not going to get, as she said, past the door with that. And so those are just some of the skills. Listening, I would say, a lot of patience. You just can't rush the community when you're doing this kind of work. We all have our timelines. We all have our deadlines that we have to meet, but we also have to understand that folks who are partnering with us have full lives. They're working, they have families, and they're choosing to work with us. And so we're not going to gain anything by rushing them in the process. We have to find a way to kind of meet in the middle and still achieve our aims while working with those who've chosen to partner with us. And the last piece for me that has been a skill that I'm still building is networking, especially if you're in a smaller community where everybody seems to know everybody, and you're maybe the odd person out. That isn't necessarily one of my strong suits. And so I was able to work with one of my colleagues who's faculty in the area, Dr. Kent Key, and also our advisory board, who've been working in various capacities around the community for 20 or more years, 30 years, some of them. And not only have them introduced me to folks and help me understand kind of what the connective tissue of the community looks like, but also realize I don't always have to be out front. I am the PI of a particular project. I do navigate that part of the project, but I'm not always the most productive face that folks need to see out front. Sometimes I need to put our advisory board out front and make sure they're the presenters. Sometimes I need to make sure that our my colleague who is working in the area, who is literally at every event that's happening, that everybody knows their name, that they're the first face that folks see, and the one that they talk to, because that's the person that they trust. And so I don't have to always be the messenger in order to be effective in terms of partnering. And so that's some of the things that I've learned and skills that I'm trying to build in that area.
Thanks so much for that. I really appreciate all the tips you've given us about unknowing what you think you know about cultural norms and stepping in and just being really humble, have empathy, grace, as you stated. I appreciate all of that from all three of you. And I wonder if each of you could share an experience about, because the name of this program is Ethics and Challenges in Research, if you could each talk about the role that ethics plays in your work. Dr. Mitchell, you mentioned institutional review boards. That's kind of academic insider talk. Maybe I'll just let you start and talk a little bit about your experience with that. And you don't have to talk on IRBs, but yeah, just the role that ethics plays in your research.
Absolutely. So, I mean, ethics are going to be at the forefront of the work that, we're all doing in the academic community partnership space. So I think about, the populations that we work with. Many of them are, vulnerable, or perhaps they've had some poor experiences with healthcare or with research in the past, and they may be weary to participate or to engage with you. And so, you have to think about all of that in terms of, how you present yourself, the messages that you convey to the community. And there aren't a ton of second chances, so you can't mess that up. You really have to be intentional from the beginning. And that transparency is also a part of the ethics that we've all been talking about. Transparency, that's also a part of the ethical landscape, right? Like making sure that folks know at every step of what we're doing, that we're crossing our T's and dotting our I's, even down to our documentation of our work and things like that. That's all a part of the ethical space. For me, I work with older adults and have for many years. And so, one of the things I had to think about is I'm building a research pool, or some folks call it a registry, of folks in the community who want to participate in research. But there also is a segment of our community, of all communities, who may have things like memory issues, other mental health issues, and they may have a desire to participate, but not fully grasp what it means to be involved in that kind of work. And so, above and beyond the type of education that we do, we've created promotional videos that walk folks through the steps of what we're doing. But then we also have to say, no matter what our recruitment goals are to do this, no matter what our responsibilities are to our sponsor or our person who's the organization who's funding our research, if someone really doesn't grasp the concept of what we're doing and they're not able to make an informed decision to participate, we have to say, hey, come to our lunch and learns, come to our free events, come to the health fair, we'll see you there. This opportunity may not be a great fit for you, but there's all these other great events happening for seniors in the community, and let us connect you to those instead, right? So you have to be willing to not turn down folks, but to divert folks who may not be a good fit, because ethically, in your heart and by all of your measures, that they may not understand what their participation means, and so they can't really consent to be a part of the process. And that's something that you deal with, working with all kinds of populations and older adults in particular. So those are some of the things that we've been thinking about in the ethical space.
Much for that. Maha, you want to go next?
Yes. So also I'm working with the other end, like adolescents and young adults. And usually I have to consider the parents. And if they don't understand English, I have to usually speak in their own language. So I even my research assistants, they are bilingual, and they explain. I have the paperwork in Arabic, for example, if I'm working with the Arab American. So I make sure they understand, and I have the ethical commitments that they understand and they have informed decision. Also respect their fears and boundaries if they don't want to participate, especially because they are their kids and they don't want the kid to participate. Again, the last project, I was collecting blood samples, and there was a lot of questions like, why do you need the blood sample? Are you going to use them for something else? And I have to explain to them that ethically, I can't use them for something else. I have to do only the test I tell you that I'm going to do. I can't do anything else. Ethically, like I'm gonna get fired. So I tell them that, and they feel more comfortable. Like, oh, so you guys cannot do whatever you want with the blood samples. I said, no, definitely we can. And I tell them about the process, at least, with Wayne State, what process in place to protect people who are involved in research, and we cannot abuse their information or data. I also do biological data, which is I use, for example, hair to look at cortisol levels, and that will reflect on the stress. So cortisol is a hormone that our body secretes when we are stressed out. And hair cortisol, like it's the cortisol deposit in the hair. And the more the hair grows, like the first 3 centimeters, will reflect your stress in the last 3 months. So that was like fascinating. And I was telling people about that. But they were asking me, why you want hair samples? And I explained to them how I'm going to use it and how I'm not going to use it for anything else. Like I can't test drugs. I'm just using it for cortisol levels. So that was exciting. And show them like a video how I'm going to take the sample without showing, gaps in their hair. So I enjoyed that work, but tons of it, explaining and being transparent, and everything goes with that. So I think it's not only having the ethics in place for our funder and for the institution we work for, but also explain to our partners in the community our ethical consideration and commitments, so they can actually understand and help us, because if they understand, they are on board, they help you more. But so I think that's very important.
So much great examples.
So I think mine is gonna be a little bit different from that aspect. So I can do it from a professional aspect as well as a community advocate aspect. One of the things, I'll start with the community advocate aspect. Everything that we do is ethical because ultimately, our organization has been around since 1935, and we have made significant impacts in the things that just happened to African American over the last 87 years. So one of the things that we also have to be mindful of is the social justice or civic justice or initiatives of healthcare initiatives that we take on, because the point of us taking on and running and fighting these battles is to make sure that we're making a positive impact in our community. So everything about that is an ethical aspect. So whether we're having conversations with people to say, what would you like to see different, or what would you like for us to do, or what would you like for us to host? It's not about us getting numbers to report to some funder to say that we did these numbers just because you're asking us for an impact study. It's about making sure that we are actually doing good in our community. And at the end of the day, for me, it's about making sure I can go home at night and close my eyes and go to sleep, because I know that I have done well and protected their data from that aspect. From a professional aspect, I am surrounded by data every day. So I think Carrie briefly told you what I do, but basically, if you are in the electronic medical record in any health system, I probably help design it. And that is what I do. So I design health electronic medical records. And so a perfect example for me is that when we're first bringing up a provider going from paper to the electronic medical record, we ask them, do you want us to be on site? Do you want us in a room with you? Because they have to be able to actually put their information in the computer. The first go live that I ever did for the first system I built, I walked in a room and it was somebody I knew. And I just stopped at the door and I said, you need to have a conversation if it's okay that I be in here. They was like, no, I said, you know that an IT person is coming here. I know who that is. So I'm going to turn around. You need to specifically ask, is it okay for me to be in here to have this conversation to help you? And ultimately they said yes, because they was like, we know what you do. And I was like, okay, thank you. But again, so in that situation, I had to be able to look at that person any other day that I saw them anywhere and know that I just understand half your medical history. And that is something that I never, ever really wanted to know if you were definitely not my family. But that is a situation I have been in a number of times because of the work that I do. And so that is one of the biggest ethical things that I do. And one of the things I have to say is that the best way to handle it is to make sure you have that permission, you have that conversation, and you don't have to be the one to obtain it. Whoever's asking you to be in that situation needs to make sure that they have it. And so for me, the doctor said, yeah, they said, okay. And I walked in there again and I said, okay, we're not gonna have no social media foolishness. You okay with me really being in here, helping him be able to document? Because at that point, you know, when they start to enter the things into the medical record, they have clinical decision support. So the system comes back and tells them things they need to do. And that's when I really have to get in there and say, okay, this is what it's telling you need to do. Do you want to order this? Do you want to send them for this? Do you want to create these referrals? These are things that a person needs for any of their healthcare aspects. And for me, I'm a healthcare advocate. You know, I'm all about it. And so, you know, when you get to turning your face up, I'm going to sit there and say, I think you really may need to do this, but it's one of those things, and having that conversation. So for me, on a day-to-day basis, like I said, I see data all the time. I see the data of celebrities all the time. It's about making sure that I respect that privacy, respect who they are as a person. I don't know anything about them necessarily personally in most instances, but it's about the fact of protecting their data. So we have all these data breaches and everything going on. And one of my biggest things is making sure that whatever we design, whatever we implement, from that initial perspective, you know, I can't really control whether you come in through our network and get access to it from that aspect. But when you're in it, when you're in this system, making sure that security is there and making sure that that protection is in place is what I am committed to in that aspect. And again, it's respecting the person. You know, I have had some colleagues that see something that we're working on and they'll make a joke. And I'm like, you don't know that person. You don't know who that is. You don't know why this is going on. So don't do that. Mm-hmm. So those are things that I do. And so it's about, you know, respecting who they are, whether you know them or not. You know, that is the most ethical thing I think you can do. Respect the data, secure the data, and explain to them how you're going to secure the data. So from the community aspect, you know, when you're collecting all this data, so you say the hair samples and things of that nature, okay, where are you storing it? Where is it going to be? How secure is it going to be? If somebody, are you going to sell it? You know, what else are you going to destroy it? You know, one of the biggest things I think about is the DNA sample kits that go out. So you have all of these companies out now that are storing the data and storing the samples. And what we have found out is some of them are actually selling them, but then you have some that are actually destroying them. So again, it's about making sure you clearly be transparent and clearly explain what you're doing with the data and the samples, whatever it be that you're collecting from your participant, to make sure they are really comfortable and fully understand it. Because my whole thing is, I feel like if you don't need that data when you're done with your research, it needs to be destroyed. Mm-hmm. If you don't need that sample, it needs to be destroyed. I don't know why you're keeping it. You know, you have a nice little records, a nice little graphs, you know, do that. And I know from my aspect, you know, I store data all the time, but unfortunately for us, we have to keep it in that line of work. And it gets to be a little bit interesting in this back, especially from a medical legal perspective. So there are many days that I've had to sit in a room with some attorneys to teach them how to understand how a provider got data in an electronic medical record, because they have to go to this case. They don't really need to look at it or really understand what the data says, but they need to know how the data actually got in there. And if there was a data breach, or if there was some employee that accessed something, how can they see that? You know, those are those opportunities where I think I've learned a little bit more about it from that. So everything that I do, I think of it from a medical legal aspect, you know, and for me, in medical legal, it's always about the ethics of anything that you do, because if you're not, you can be sued, you can be held liable, you can be fined millions by different federal organizations for a violation of that data. So it's really key to make sure you're secure in it and make sure you respect the people in the data that you're collecting.
Mm-hmm. I'm so glad that you brought up and said that this is social justice. I think of all three of you as advocacy, you know, using your work so that you're advocating for the population that you really are trying to serve, and making sure that the research can be used as a tool to really make improvements and changes. So thank you for bringing up that term, such an important.
Yeah, we consider ourselves trusted messengers. That's what we try to be. We want you to trust us, and we want to get the message out to you. We want to debunk the myths and make sure you have all the facts for any of the decisions that you're making and anything that you want to do. I am not the voice to tell you whether or not to participate in a research study or anything. I am the voice to tell you why you should consider participating in a research study, or the opportunity for a research study exists, you know, to try to help navigate the terminology that you may or may not understand. But that's as far as I really kind of take our role. But we're trusted messengers. We try to train each other to be that, to respect that, they understand that. And that's what we consider ourselves, is to be the trusted messengers in the community right now.
Thank you so much for that. I'm just going to pause and check in with Radlisha and our audience to welcome questions. Dr. Sneed, are you there?
I'm here. So far, we don't have any questions. But if you all do have questions, please be sure to write them down. But right now, we don't have any.
Thank you, Radlisha. Anybody here have a question? Yeah.
Well, first of all, thank you to all. This was awesome, and everything you shared is just really resonates with me, having done research for a number of years. And I just want to get your thoughts about, so you did everything, especially Maha, some of the things you're talking about around informed consent, right? Talking about ethics. A lot of ethics and researchers are supposed to be captured by this informed consent process. And I always have to tell my team members, like, informed consent is not just about signing a form. Informed consent should be a dialogue, it's a conversation, right? So that people understand. And I was just sitting here thinking, like, oh, like, I have used really the informed consent process as a way of building rapport and building trust. Like, there's parts where I say, okay, because I always go through every single section, like, what is the purpose of this study? What are we doing? What will you be doing? What will I be asking you to do as part of this study, right? But then you have the sections on, like, the voluntary nature of the study, which is where I kind of really get into it. And I don't know, I wonder if your experiences with this, but just really, no problem. Just really using the informed consent form. So, like, to say, because that's a part for me to say, hey, because especially for, like, a survey study, if there's a question that you don't want to answer, you don't have to do it. Like, I want to give people a sense of control over their experience in the study. And I tell them, like, if you decide, we could go through this whole interview today. And if you decide tomorrow you don't want to be a part of the study, I'll rip everything up, or I will destroy it. And just letting them know that. I try to use that informed consent, that process as a way of letting them know that there are checks and balances here, and to teach them about what research is and what researchers can and cannot do. I don't know if you've had experiences like that, Maha or Jamie.
I agree with you, especially with the part about asking them. They can skip questions if they don't feel comfortable to answer, and also they can withdraw at any time. I think that is important. And also I want to highlight that we have assent for adolescents. So if they are 12 years to 17, they also need to sign a document, and that document should be even in, like, lay language, where you're going to explain to them what you are going to do. And usually I find that powerful because they feel, they have control. Like, so I tell them, you're going to be filling out these questionnaires, and I tell them about what type of questions they're going to answer. And I make it also very clear why I'm asking them demographics, because they get alert because I'm asking them about income. And I explain to them, we're not going to look at this at your family income, but overall, like, we're studying, like, we're trying to learn about the people we are serving. So overall, how is their income? It will help us, like, when we decide on programs that are important for that community. Or so I tell them the value why we collect the data, but other than that, I would tell you, why do you need my income? So I think definitely I have those moments to use the informed consent to give more information, and also give power to the adolescents so they get into that decision-making mode. They have control, and I like that.
Can you explain the concept of assent?
Assent is exactly the same as informed consent, but it's a very simple language so adolescents can understand. So you tell them the same sections, like what you are doing, what exactly the expectation from them participating, how you're going to use the data. It's voluntarily, and they have to sign it too, and their parents. So it's very similar to informed consent, but in a language that young people can understand.
Thank you so much. And just to clarify also, like, anyone of that age, they cannot participate in research without their parents.
Right.
Or guardian consent.
Right.
They
Right.
need both things.
Right.
And Commissioner, I wanted to give you a chance to respond if you'd like.
Sure. So it actually reminds me of an opportunity Dr. Thompson gave me a few years back, which was to talk to the Black Men's Cancer Action Council that was a part of one of her wonderful projects. And it reminded me of what I think Dr. Cole said, which is that community members, especially in this case, Black community members, always remember Tuskegee. They may not even know the finer points of the historical event, but they know that it was research abuse. And so one of the things that I found helpful in giving that talk was to actually show folks not only what the actual event was and how egregious it was, but also what protections came out of that, and how the current like research landscape has been shaped by past abuse. Because I think you build trust and you help to allay people's fears when you acknowledge that bad things have happened. And because of those things and our knowledge of them and trying to reckon with those things, protections are vastly different and vastly enhanced in the current times for the research that we're doing. And I found that audience and any audience that I speak to is really receptive to that acknowledgement. Yes, these things happened. These things were real. They had long-term multi-generational impacts on folks, and they certainly affected the trust or the mistrust that folks have in being affiliated or with any kind of research. They don't want to confirm any stereotypes about their community or about their particular group. They don't want to sometimes even find out anything that may be psychologically harmful, things like that. And so talking through the historical impact of those things, acknowledging those things, and then laying out in jargon-free, accessible language, like here's how we got to how protected you are today. And I think that's a great entree, for groups. You can't do it for every single person, but into the informed consent process, helping people kind of understand how we got to where we are today. And I just found that the groups I've talked to, including the Black Men's Cancer Action Council from a while back, was just really receptive to understanding the current dynamic and the current protections, but also how we got here from the historical events they have all heard about and, have in their mind.
That's a great example.
That's
Thanks
nice.
so much for sharing that
Mhm.
example. That's awesome. Other questions? Radlisha, I wonder if I could ask you about, you have such an interesting study and background. I know you're our moderator, but I wonder, you work with such a particularly vulnerable population that the institutional review boards that all researchers have to use when they're conducting any studies is just an incredible effort to go through. I wonder if you could just talk a little bit about your experience in your work related to IRBs and your experience in your research.
Yeah, so I do a lot of work with older adults who have criminal justice system involvement. So this may be people who are currently incarcerated, as well as people who may have been previously incarcerated but have now gone back to community settings. And most IRBs think of this as a vulnerable group. Certainly, people who are actually incarcerated are officially considered to be a vulnerable population. But even those who've had criminal justice system involvement have, also are vulnerable, and, there are definitely special protections in place to make sure that this group isn't being exploited. And so, we have very rigorous IRB approval processes related to working with this population. One of the biggest things that we see is that, sometimes people want to do work with justice involved adults because they think it's an interesting group to study. And that's really not the purpose of, working with this population. The work that I do is very much about quality improvement and wanting to make sure that we're doing things that will potentially have direct benefit for the population that's being served. And that's really, really important, because this is a population where you see people who have been stigmatized already, people who have probably been mistreated by multiple systems, who have a fair amount of disadvantage, who may have low literacy and low education. And so it's really important when you are connecting with a group like this, trust is an even bigger deal in working with this population than what you might see in other populations. And so it's really takes a lot of time and dedication to establish trust, both with the people that serve this population as well as those within the population itself. And so a lot of what Jamie mentioned before about really sort of taking your time to work with partners and building trust, and recognize, making sure that they recognize that you're trying to work in collaboration with them ultimately to do something impactful is really important. So in the work that I do, I really take my time in working with partners to make sure I understand what they need and make sure that they are a part of the process of building what we're building is really important. I've never, had involvement with the justice system. I don't know the population and I don't know their needs, and I'm not going to assume that I do. But it wouldn't be ethical for me to come in and to push forward without making sure that the work that we're doing is collaborative and that we're really working towards a common goal. So that's just really important in all of the work that I do.
I think she undersold how the process that she goes through to be able to. You're so humble and lovely, but my gosh, I can't imagine what that looks like. All of us are challenged by an extraordinary population that you're advocating for. Thank you for sharing that. Sorry to call you out. You're not the panel speaker.
Well, I can say more about the IRB process if you'd like, if that'd be helpful as well. So because I work with a vulnerable population, all of the studies that I do have to go for full IRB review. So, the entire IRB gets together. They review everything with a fine tooth comb. Thankfully, there are a lot of investigators at Wayne that do work with justice involved populations. So there's a lot of experience in the room. And so, anytime we make any changes to any of our projects, we go for full board review, which at Wayne happens roughly every other month. I do work with multiple prison systems, and each one of them often has its own IRB process as well. Because they want to make sure that we're not doing anything that's going to potentially damage the reputation of the department, that's not going to put any of the incarcerated individuals at any additional risk. And so that, really it's quite rigorous, but really the goal of it is making sure that the population is protected ultimately. So we have a lot of engagement with the IRB. I'm thankful I have a very experienced research coordinator who knows the IRB better than I do even. But really, when we have a population like this, it's really important to make sure that we're doing everything the way that it's supposed to be done times 100%. So really, there's a lot of protections in place to make sure that we're not harming this community that's already probably been harmed quite a bit by a lot of the systems that are currently in place.
Oh my gosh, thank you so much for sharing that, Dr. Sneed. It's very helpful. While we start to wrap things up and I ask for final questions, Naya and Alex have evaluations, and we can't do this work or justify the fact that we need support to have these kind of events unless people respond. So you'll see a little link in the chat for our online community for everybody to respond to, and then we'll pass out some printed versions, and hopefully you just give us some feedback. We do use this, all of the data we collect in the evaluations, which was this helpful, but also do you have ideas for future events? Because really these, all of our events are shaped by input from people that attend any of our events. So we really do use that to shape all of the work we do. So I have to just focus on evaluation for a second. So, and any other questions from the audience online? Radlisha, you have anything, or you're good? You're okay? Anybody?
No,
Yeah.
questions.
Go ahead. Okay.
Oh, so I was just curious, how many requests do you get from researchers like in a given year or so to kind of reach out to that's two more questions, to reach out to your broad constituency? And the second question is, how many researchers come to you to say, hey, let's work together to develop a project?
Did you hear that, Radlisha? Everybody online can hear Haley's question?
No? Did you?
Just checking.
Can you say it one more time?
Yeah.
I think she took it
Here
back.
comes Naya.
Oh, thank you.
Just to make sure our online group can
Yeah,
hear.
sorry about that.
Can't hear it at all now.
I can't hear.
What is my question is for Kenyatta. How many requests in a year, like on average, do you get, does your organization get to disseminate surveys or, introduce research to your constituents? I'm just curious, because I know you have huge reach. And then how many folks have ever come to you to say, hey, let's develop something together, right? Let's kind of develop the methods, the idea, procedures, collaboration, out of curiosity.
So I'll answer the first question, the last question, first. None. Nobody has ever come to us and said, okay, let's create a project, let us understand what your reach is. And so that's why as an organization, we created Good Health Wins. So Good Health Wins stands for the Good Health Women's Immunization Network. And that is a network where we try to address vaccine hesitancy. Whether it was COVID, originally it was started during COVID, so it was COVID, but it's really just about immunizations in general and vaccines, routine vaccines, and that's where we are. And so that's why we started that, because we had the opportunity to get funding to have this conversation, and the organization that is funding us was like, hey, we know that there's a low rate of vaccinations, immunizations amongst your population. So absolutely none. But now that people know that we have Good Health Wins, we start to get these little inquiries and these little, I call them little tips or little things that, but as far as how many have actually reached out to our organization, it definitely varies. I would say for 2023, where we are right now, I think we've only had about 3, and we haven't participated in any of them, because I want to say the reason why they came was I went to a immunization conference last fall, and we were surrounded by organizations that had never really figured out how to integrate in populations of color. So the inquiries that I have gotten is because, now here we go, this was a year ago. So the inquiries I've gotten now is, you thought we were going away. You thought that our funding was going to end, but guess what? We have been renewed for a 4th year, and our reach has continued to grow. And now we're getting ready to have a summit in December where we're inviting 80 other community-based organizations to hear what we have done. And the CDC is coming to help us do this. So it's a different kind of conversation. So now organizations are kind of figuring out who we are in our reach. I mean, people don't really understand. And for those who don't really understand, so the National Council of Negro Women is an organization of organizations. So what that means is we have our NCNW members and we have our 33 affiliates, where our affiliates are organizations like the Divine Nine Sororities, Alpha Kappa Alpha Sorority Incorporated, Delta Sigma Theta, but we also have the fraternities. So that makes our reach from 2 to 4 million African Americans that we can touch. And people are just starting to really understand what that significance is. And people are really starting to kind of reach out, but none of them have been what I consider genuine. And again, it's about the 5 W's. What are you asking us for? Are you just trying to get our name recognition, or trying to get in here for some other reason to benefit the community? And so that's one of the things that we do. And some of them are like initial inquiries. We have that 30-minute conversation, and they're going to follow up with some detailed information, and they never follow up. So it's not necessarily that we just turned them down. It's just that they haven't done the follow-up on their side.
Thank you. Good question.
Nice. All right. Final questions?
I don't have a question, but I'd like to state that I have been here to experience this, because I'm sitting here thinking, I don't know anything about what you're saying. But I'm learning just this little bit. But if I'm from the community and you're asking me on the back here about CEN something, CENR, I don't know what that is. So we need to engage in the community. We need to start with letting us know, what does research mean? What is it? And then with all these different titles and things, I'm looking like, okay, now where am I at?
And that was going to be one of my questions. We keep talking about IRB, and I can honestly say I only know about IRB because I just really participated in the Community Health Scholars Program that they offer to community members. But, when we say IRB, you all know what it means, but we really don't. So, in layman's terms, it's an advisory board for all of the researchers. It literally tells them the things they can and cannot do for a research person. And if they violate any of that, they have consequences and fines that they have to do. But I realized that as they were talking about it, I'm like, I don't think they ever really said what that is, but it is a huge review board. It's almost like their own private federal government, if you want to think about it, that keeps them in line for all of their research that they do. So again, that's one of those things when I say, when we do our layman's terms and the communications and conversations, those are definitely things that, we have to be mindful of. I didn't even look at the survey, so that's interesting.
Yeah, these are the I'm sorry for that. And the acronyms, I am so guilty and so bad at it. And IRB and CENR. CENR is Community Engaged Research, and the IRB is the Institutional Review Board. And we do have a program. This is actually our agenda and the questions that I drafted for our panel members. So you have the document that is really kind of an internal thing. So I apologize that that's not clearly, the acronyms aren't spelled out and whatnot. So apologies for that. And thank you for pointing that out. We have our own, I have a lot of blind spots and take for granted that the jargon and the acronyms that we use and throw around are just, it's not common knowledge to everybody. So sorry you're reading that and going like, what am I looking at? And what are you using acronyms for? So.
But it's good to come and learn.
Yeah.
It's good to experience what you presented, because some of us may not have ever been in this type of situation before.
Yeah.
And so I'm sitting here learning and thinking, oh, you need to get closer to the community. And then closer means letting us know what you're doing, why you're doing, and when you're doing, and explain it simply. Simply. So we'll get it.
Yeah.
I can go home and say, well, this is what I did this evening and why I went, because I wanted to know what was happening. And this is what I learned. And I didn't know anything about Wayne State having your program or anybody else's program, but now I know. So this was good for me to understand. So you're looking at people that are coming from the community. I graduated from Wayne State, so, but that's not what I came here for. I came to understand what you're talking about, what you need for us to be involved in terms of research. Research it. If you're gonna work with our people in the community, you know, you need to know what to do. How you doing it?
Right. That's for
What
sure.
you're gonna do with them,
Thank you for
because
sure.
we have our restraints.
Right.
We're gonna go so far with you, you don't tell us all of it. We're gonna back up all of it.
Thank you.
Carrie, we have a question here
Okay.
that asks, how will the information provided this evening be summarized and shared?
I'm sorry, I didn't
How
hear
we
you.
summarize and share today's program.
Oh,
We
thank you.
recorded it.
Oh, yeah, sorry, Radleisha. So we have, it's not accessible to everybody, but on our checkup website, we record these programs so that what happens today just doesn't live in this room, right? So that other people can benefit and hear and learn and replay. I know some people, I've used some of the recordings in my own lectures and classrooms and things like that, so that we capture this information so it can be recycled and spread much further. Now, we also appreciate not everybody has access to technology, right? And so there's some limitations there, but we do our best to have the, this is our fifth event, I think, of the year, fifth event, in person, so we can meet people, but also record it so that we can recycle and continue to amplify the voices of the people that are so generous to spend their time with us and share their experiences. So it goes a little bit farther from just the audience that we meet in person. So I hope that helps. And, and our principal, who is so gracious and here very late at night, past the day, I'm sure tired, but please, yes.
No, this was very worth staying after. And first of all, I would like to just say thank you for allowing us to be on the whole site. But as I'm sitting here, I had so many aha moments, and I learned so much from the panelists and the discussion. I was just thinking about all the similarities and the strategies used with building trust, transparency. Because like in your field, we send home surveys. We do more to just educate, and sometimes if our families don't know the intent, whether it's home visits or whether it's us trying to secure immunizations, with the COVID, the time period COVID at its heightened period, I seen a decrease in the number of immunizations, and it was very difficult in our realm to just secure, a lot of that. So again, I just want to say thank you, because I learned a lot tonight that's making me reflect on, how can my team build trust, establish more relationships, and educating our parents as it relates to the work that we do. And then again, the collaboration is important. So again, I look forward to just continued partnerships so that our families can be educated in all realms. So thank you.
Thank you so much.
Thank you for having us.
Your PTA is probably the voices of your community that you serve in the same way we have a community advisory board. So we get that feedback and have people's voice present in our process. So I make sure that we're tailoring what we need to the audience here. I never really made that connection before, but I can imagine. I have no idea. But thank you so much. And for being here very late on a Thursday.
We appreciate that.
Thank you very much. Well, anybody else want to make any final, thank you, Radlisha, for being here. Dr. Mitchell, Maha,
Thank you.
I just want to give everybody a round of applause. Thank you, thank you, thank you.